3, 2, 1.
Great. Hi, I'm Jolene Pinder. I'm here at the head office of EMS in Nyon in Switzerland, and this afternoon I'm going to be talking to you about the new GBT machine and in particular the new PI Max module. I'm really excited to be here as my journey with EMS started in 2012, and all I have seen from the company since then is improvements in the equipment that they provide. They've made my working life a lot better in a day-to-day setting, but most importantly, they've made the lives of my patients much better as well, because no pain technology means happy patients and also happy business owners, because patients will come back and return again and again for their treatments because it has been pleasant. Just a little bit about me. I'm a dental hygienist. I work full-time clinically. I work in the dental health spa in Brighton with my fellow Swiss Dental Academy trainer, Christina, who has been the owner of the dental health spa for 18 years come September. It's a real honour to work alongside all of my colleagues at the dental health spa, and they provide me with some great support and the ability to be able to carry out all of the treatments that I provide for my patients in a really nice, comfortable manner. The very original machine that I used when I first started working with EMS is completely different to the lovely fella that I've got here now. I've been a dental hygienist for over 20 years and worked in various practices throughout the UK during that time. I'm delighted to say that I was one of the first people to implement GBT in the UK, and I have also been one of the first people to use the new GBT machine, which is also fantastic. It is a brand new concept in treatments, and to let you know just exactly how different it's been, I can give you the benefit of my experience. I've been very lucky to be testing the machine for the last 8 months now in clinic. So each and every day that I've been going to clinic, I've been treating my patients with this GBT machine. Initially, I wasn't sure what to expect when starting with the new device, and was really pleasantly surprised at the improvements that have been made to not just the PI Max, which I'll speak to you a lot more about, but the whole device in total. Sustainability is something that is a key word in dentistry, and this new device is exactly that. With the glass casing and the aluminium, it makes it much more robust. The way that the handles are, or the way that the water pressure is dealt with is much different. There's aluminium on the outside of that as well, again much more robust, and the cords have changed as well, so the cords feel a little bit heavier and they are a lot more, again, robust, so it's fantastic. But what I really wanted to talk to you about is about the PI Max. So the PI Max the PI instrument has always had the ability to detect deposits and increase in power and strength as you go along. So the dynamic system regulator within the PIEZON PS has been phenomenal for the last few years. It means that when we're working away and we feel some calculus, the instrument tip feels the deposit and increases the power for the time that the deposit is felt. The new PI Max module 50% increases that. So gone are the days of struggling to remove those far more tenacious subgingival deposits, those heavier deposits in patients that perhaps haven't been to see us for some time. We now feel that this instrument really increases in power and makes our jobs so much easier. A really important thing to be aware of is the patients feel nothing different in terms of how they perceive the increase in power. And in fact, they feel so much more comfortable as well. The very first day I used it, I was unsure what to expect, as nobody had told me what to expect from the device. I wasn't told that it had more power. I wasn't told that there was a 50% increase. I wasn't told anything about it. They simply said to me, Jolene, please go into clinic and use the GBT machine exactly the same way that you would have used the old machine. And that is exactly what I did. So those very first patients that I was treating, I was tentatively using the instrument, waiting for something different. And it became apparent very quickly that the difference was clear. The PS instrument and the PI module previously, the strokes that we use, because the instrument moves in a linear way, we need to use nice strokes that follow the line of the instrument. So you need to be very precise about how you place your instrument. You want to make sure that you're using the working edge properly and appropriately. So it's really important that we still use that same principle when we use the PI Max module, but really brilliantly is the days of really having to work harder and harder and harder to get those deposits off are gone. I was pleasantly surprised as I saw a new patient on that first morning, somebody who hadn't been seen for over 10 years, and this PI instrument really blew my socks off. Being able to remove all the hard deposits was an absolute joy. The tactile feedback from the instrument, if you've ever used this, will tell you that the tactile feeling behind it, you can feel subgingival calculus really easily. It's got the same, the PS tip that goes on the PI Max has got the same diameter tip as your Williams probe. So when you're doing your more subgingival treatments and your more complex treatments, you don't have to keep stopping and starting and going back to your probe. This uses the same feeling, tactile sensation as your Williams probe will, and it will show you exactly where you need to be working. I've not really had to use the boost function on this instrument, but it is available still. So again, you move your foot from the side of the instrument to the centre of the instrument to allow the PS instrument to boost and the PI Max to increase in power. But to be perfectly honest with you, it's not a feature that I've used very many times, because I believe the power that we have got in the new PI Max is enough to carry out good treatment for your patients. In terms of settings, the settings of the machine have been really simplified. So instead of having numbers on the front of the machine like the old Airflow Prophylaxis Master, we've got settings. So we've got low, medium and high settings. When you look at the low settings, you're talking about operating about 1 to 2, and your medium setting 3 to 4, and your high setting 5 to 6. To be honest, if I'm doing a maintenance patient, then very often I'm using my GBT machine on the lowest setting, which means it's minimally invasive, it's exceptionally comfortable for the patient. Again, we've still got the warm water technology, nothing of that has changed, but it just means that I'm able to be much more efficient in a shorter period of time than I would be normally. For those more challenging patients, for the patients that haven't been for a long time, I tend to use the device on the medium setting, which is 2 dots on the front. The water stays exactly the same. And what you'll find is, again, with that tactile sensation, you can move around the mouth really efficiently and well, just keeping it on the same setting, with the module inside increasing in power when the hard deposits are felt around the mouth, whether they be subgingivally or supragingivally. I asked my patients for some feedback on the device. I didn't tell them much more about it, but I did just say, I have got a new device and I want you to tell me if anything has changed for you when you come to see me. And to say that the positivity of my patients has been overwhelming. So they don't understand the technology behind what I'm doing with the device. And in fact, quite often they don't understand what we do. I think they think we go in with some sort of magic wand to remove their hard deposits and to improve their oral health. But what they were saying and reporting to me was that the sensation was less and the comfort was more. Also, the time spent removing the deposits was less for me. So for me as a clinician, it's much more comfortable for my body. I hope to have a longer career in dental hygiene than I have already. So I've done over 20 years, and luckily having used this equipment for a lot of this time means that my body has not suffered from poor positioning. The ergonomics of the machine are good. I'm not hand scaling as much. In fact, I barely hand scale at all, if any times. I certainly don't use hand scaling for my periodontal maintenance appointments, and I certainly don't use it for my active treatment appointments either. I do stick with my PI Max. What else can I tell you about the PI Max tip? Well, it works exactly the same as the other one. The function is the same. The tips that can still be used. So if you're using the PSL, the left-handed instrument and the right-handed instrument, they can still be used. The PI Max instrument can also be used. For those of you that haven't tried the PI Max, I can highly, highly recommend it. That tip in conjunction with the new Max module on the handpiece is a game changer for maintaining implants. And for those patients that are a little bit more challenging, composite bonding has become a thing that is very popular, and certainly in the UK, and I know throughout the world, we do see a lot more patients having a lot more cosmetics work. And to be able to use a tip that can effectively remove the deposits that are around this work without damaging any surfaces and providing your patient with a comfortable experience is second to none. It certainly makes my life an awful lot easier as a clinician. I think those that are watching and understand about when patients are anxious, that they by consequence make us very anxious. My anxiety levels are certainly lower when I'm treating patients that I am worried about with sensitivity, simply because I trust the instrument and I trust the process. In terms of other maintenance, the machine's so much more easier to maintain than the other one. And I think the other thing about the device is it's much more simple to use and operate. Gone are the numbers on the sides, gone are the numbers on the front. It's a very simple process of the water's very clear how to switch it up and down by using the dial on the sides, and the power is simply operated by a finger touch on the front of the instrument as well. So all in all, my experience using the PI Max for the last 8 months has been nothing but positive. I have been asked numerous times by the product development team if there's anything I would improve, if there's anything that I would like to see. And to be honest, I normally give them a list of things that I would really like to change. And this is one instance where I haven't had any changes that I'd like to make. Another thing that I'd like to just touch on, which I think is really important, is we all like to check that we're doing the right thing with our patients each and every time. This new device has Wi-Fi compatibility, which means it's connectivity as well. I'm able to, at the end of each clinical day or throughout the day, check my progress. And by my progress, I can check to see how long I used my airflow for, how long I used my PIEZON for, and what settings it was used on. So it's checking me for GBT compliance. It checks you patient by patient, so it records each individual patient as you're treating them. So it's really nice to be able to go in and reflect on my day and look at my patients. And I know different countries have different standards and different appointment times, but I tend to see between 14 and 16 patients in a day. So it's really nice for me as a clinician to be able to go back and reflect on my day. And for those more challenging patients, or for patients that I think that perhaps I could have done something differently, I can go back and see exactly what my device was doing and maybe think about what I could do differently on that next appointment. So the connectivity is absolutely brilliant. And I know Christina would say from a business point of view, it's also great because you can look at all of your clinicians and identify if there's any training needs, if there's any that needs a little bit of extra help with their instrumentation or with their power settings or their powder settings. So all in all, my experience using the PI Max in particular has been very, very positive. And if I have any suggestions to you all, is come along to a course, come along to anything that's going on, dentistry shows. We've got the GBT Summit coming up. If you're not sure and you want to come and try and see what this instrument feels like in your hands, I can highly, highly recommend coming along. One of the experts will be there to be on hand to talk you through how to use the instrument, how it works, all the little nuances, all the good things about it. And also, at the majority of these things, there's a great chance to get hands-on. I can't tell you how important it is to feel this instrument in your hands. I can't tell you how important it is to feel it in a patient's mouth. And also, I can't tell you how important it is to get that really fantastic feedback from patients at the end of the appointment and them really happy to be able to come and see me again. I hope you've all enjoyed listening to about the information about the PI Max. I am very happy to take any questions that you may have and hope that I can answer them. And if I can't answer them, then we'll find a way to get the answer for you and get back to you. So if you have any questions, please feel free to message. I don't really understand how all this works, but my lovely team that are behind the cameras are checking for anybody that does have any questions that they would like to ask about the instruments. Thank you for listening. Oh yeah, all good. Good. Well, thank you so much for coming along to this live webinar. It's been a shame because the weather's been a bit rainy in Neon today, so we haven't been able to see you on blog. We're headed straight back to the airport now to head back. I've got the joy of using this machine again tomorrow and all the patients and on Saturday. I hope you're all having a lovely evening, and thank you so much for joining us tonight and listening to this live section.